All right. Hello, everyone, and welcome to tonight's program, Advocacy 101 and the National Plan to End Parkinson's Act. If I haven't had a chance to meet you yet, I'm Kristen Rossi, the CEO at the Michigan Parkinson Foundation. And I'm really happy to bring this program tonight. The Michigan Parkinson Foundation is a part of the Unified Parkinson's Advocacy Council, or UPAC. And we really see it as part of our job and part of our mission to bring you all the information about public policy that we're learning from Michael J. Fox and let you know a little bit more of how you can help. Um, so we're going to be sending out the slides from tonight's presentation as well. And we're going to have lots of opportunities for you to interact too. So I can really think of no better person to talk to us about this topic than Mason Zeagler. He's the public policy officer for the Michael J. Fox Foundation for Research. He leads efforts, as he was just talking about, on federal lobbying for the national plan. He's one of the very first people who welcomed me aboard when I started at MPF, welcomed me to UPAC, and gave me lots of information. He's just a brilliant and hopeful voice in this space. And we're just really happy to have you here today, Mason. So I'm going to turn it over to you.
Awesome, thank you. I really appreciate that. And good evening, everyone. I really appreciate you taking time out of your day to learn what I have to share with you today around policy advocacy and the National Plan to End Parkinson's Act. I'm going to briefly share my screen, and then I'm going to ask Kristen to quickly come off mute just to make sure that it is working correctly. We good to go, Kristen?
We are good.
Beautiful. Well, again, thank you for your time. I know it takes a special kind of person to take time out of their day to learn about this kind of information. It can seem a little boring, or maybe it's exciting. But either way, I really appreciate you taking time out of your day to listen to me. And I also want to thank Kristen and the Michigan Parkinson's Foundation for hosting this webinar. We work together, as Kristen mentioned, through UPAC, which is comprised of Parkinson's nonprofits from across the country who seek to improve the lives of people living with Parkinson's disease and their loved ones via public policy advocacy. So I'm going to give you a little bit more about myself. My name is Mason Zeagler, and I'm a member of the Michael J. Fox Foundation policy team. As a lobbyist, I meet with advocates and their federal policymakers, primarily their members of Congress and their staff, to discuss issues important to the Parkinson's community. In my role, I do lobby on behalf of the National Plan to End Parkinson's Act. However, I also focus on issues that impact how people living with Parkinson's disease access the care they need to diagnose, treat, and manage their disease. On the slide, you'll see my work email, and I encourage you to reach out if you have questions or would like more information, or have information you want to share with me. Just from some personal background, I'm originally from Eastern North Carolina, and I graduated from the University of North Carolina at Chapel Hill in 2019. So I'm a Tar Heel. But technically, I'm a double Tar Heel because I'm actually currently pursuing my master's degree in public health from UNC remotely. So I work full-time and I'm a part-time student. I have been a lobbyist since graduating, and I formerly lobbied on behalf of the National Rural Health Association. They look out on behalf of the policy issues of rural healthcare providers, everyone from a primary care doctor to rural hospitals. And now I work for the Michael J. Fox Foundation. I myself am a rural North Carolinian who has a personal connection to Parkinson's disease. Actually, a close family friend of ours, technically married into my family, has Parkinson's, and I've seen him be the person who was leading our Boy Scout troop service projects to being the person we were doing service projects on behalf of. I've had the privilege of using my education to advance policy priorities important to the people who are important to me. And I'm going to share with you some information tonight about how you can do that as well. So it's a presentation in 3 parts. Here's a quick outline. We're going to start off with an introduction or a refresher on what policy advocacy is, as well as what it isn't, before we do a deep dive into the National Plan to End Parkinson's Act. And finally, we're going to wrap it up with how you can get involved, which will include a little bit more information about some of the resources that the Fox Foundation has pulled together, but other ways that you can reach out as well. So I'll pause after each segment of my presentation for questions. So as your questions come up through the course of the presentation, please write them down and ask them at that time. Please view this more as a conversation than a lecture. I myself am a student, and we're all going to learn together. So I'm going to kick it off with an Advocacy 101. But before I get too far ahead of myself, I want to acknowledge that most of my remarks around advocacy are based on a toolkit that is available online and linked within this slide. And as Kristen mentioned, we'll be sharing these slides with you all so you can download this resource and other links throughout the presentation. I want to touch on some of the highlights of this resource, though, as we begin the conversation today. So the Michael J. Fox Foundation works alongside a nationwide network of advocates and other Parkinson's nonprofits, including the Michigan Parkinson's Foundation, to ensure state and federal policies are supportive of people with Parkinson's disease and their loved ones, and that they support research towards a cure. As members of the Parkinson's community, you advocate on your own behalf all the time. For example, you advocate with doctors so they understand your symptoms and you let them know how your treatments are impacting your life. You may also advocate for yourself with insurance company representatives so you can access the medications you need. However, today we're going to talk specifically about policy advocacy, which is about using your voice or your story to support or recommend action on behalf of a specific cause or policy. It doesn't have to be related to the National Plan to End Parkinson's Act, but tonight I'm going to use that as our example. There are several ways that you can take action to advocate on behalf of the national plan and other priorities that are personally important to you. For example, you can write your member of Congress by sending a letter or an email to their office. You can also call their offices and voice your support or opposition for a specific bill or issue. You can also meet with your members of Congress and their staff virtually or in person to share your position and request their support. This does not have to be a dedicated meeting that you set up and schedule yourself, although it's fantastic when it is. For example, the Michael J. Fox Foundation ourselves, we schedule meetings between congressional offices and advocates throughout the year. And members also host town halls and open forums in their districts and states as well. And I want to note that research indicates that the more personal the form of advocacy, the more likely your request will be heard. So what does that mean? Well, while every form of advocacy is important and valuable and part of your toolbox, there are forms of advocacy that data indicates are more impactful than others. For example, writing an email or a letter is helpful, and staffers take note, especially when they receive a high volume of emails or letters on behalf of a specific issue or bill. But making a phone call can be even more powerful. Staffers who pick up the phone when you call will make a note, sometimes even a tally, when there's an extremely high volume of calls. We see this a lot around really highly political issues like abortion and gun control and issues like that. But they take a tally of how many people call on behalf of a specific bill or issue, and they report that back to their boss, sometimes daily, but at least once a week. And even more impactful are meetings that staff or the members of Congress themselves attend, and where advocates can voice their support and really explain how the issue impacts them personally. And at the Fox Foundation, we support advocates taking action in all the ways that they feel comfortable. But we also encourage you to consider how to reach outside that comfort zone to really have that other person empathize with your experiences and what you're going through. So in summary, each of these tactics are important tools that you can use to help your members of Congress understand what it is that is important to their constituents and why. And for a second, I want to stress how important your why is within your letters, your phone calls, and your meetings. As a member of the Parkinson's community, you're an expert on how this disease impacts the lives of constituents in your members of Congress's district or state. You can speak to the challenges of accessing care, from getting an accurate diagnosis to obtaining and sustaining the treatment regimen that helps you and your loved ones manage the symptoms of Parkinson's disease. You can speak to how it has impacted your finances, your job, the lives of your family members, and what it means for your future. We understand that explaining these challenges can sometimes be difficult, but they go a long way in helping staffers and their bosses empathize with your experiences and those of other members of the community. Sometimes when I'm on calls with advocates, I just thank them because it is a form of emotional labor to reach across and share with someone something that personal. And I want to note that when you advocate, you don't only have to focus on the challenges, but also the ways that maybe you found to overcome them, whether it's finding community through a boxing course or another exercise group, or maybe it's a support group. It's important to explain how our community is also resilient, organized, and powerful too. And sharing your stories, again, helps your members of Congress learn what it's like living with Parkinson's or loving someone with Parkinson's in the circumstances that are specific to your district or state. The issues that you face in Michigan might be entirely different than what my friend is facing in North Carolina, but it's really helpful to provide that context to your members of Congress. They need to understand why it's important for them to support the national plan to end Parkinson's Act and other policy priorities important to you. And while getting your whole Parkinson's story into a few paragraphs is impossible, focusing on one or two components is a great way to share insight into certain aspects of your life and to humanize the impact of Parkinson's disease. To some folks, if they don't have a personal connection, they just think of it as Parkinson's, you know, how the stereotypical person experiences it. But for you, you can help bridge that gap for them, explain the nuances of what Parkinson's is or isn't. And you are their constituents. And when I say constituents, they also hear voters. And you can provide details on how Parkinson's has impacted your work, your day-to-day tasks, finances, home life, friends and family, etc. Staffers often take notes and they share them with their bosses so they can paint a picture for their bosses around what they were talking about in this meeting, what they were doing throughout their day. And it's also often helpful to write notes about what you want to say before you begin to tell your story. Being able to share your why with staffers and members of Congress is impactful in an impactful and concise way is important and helpful, but it does not need to be perfect by any means. It just needs to be true to you and your experiences with Parkinson's. And for a second, I want to talk about what advocacy isn't, because I think this is something that we need to stress with people. Advocacy is not simply making a demand of a staffer or their member of Congress one time. It's about making a request and providing context about how it impacts their constituents. They're really going to mull it over and think about it. Advocacy is not about being rude. Actually, a large part of it is about relationship building. It's literally just talking to another person and explaining an issue to them. Showing staffers that you're seeking to help them to come around to the right decision and building trust with their office is important. And that kind of work can be disrupted when you're rude or demanding. And advocacy is not a single one-off action. It can be, but we know that's not how you're effective. Advocacy requires persistence and patience. You may see it as an obvious choice or decision, but they may need more time. They may need more context and information to inform their decision. It's rare that the first time you meet with an office, they automatically take your request to their boss and they do exactly what you would like them to do. A large part of the first meeting will be bringing them up to speed on what the issue is about and why it's important and how they can be helpful. They, again, may need more information or time to run it up the chain of command. There's a lot of bureaucracy within the federal government. Would you believe it? And they may need reminders about what the request was and how it will help move the ball forward. And something I try to warn advocates about is who they're likely to meet with. Many of the staffers you will encounter will look like me, a 20-something-year-old living and working in Washington, D.C. They may be from the district or state, but they may not be. They may not understand that local context. But they're trying to do right by their boss and learn about the issues important to the constituents. They likely have 15 to 20 other meetings in a given day, and they're likely not experts on Parkinson's disease. Many may have a connection to Parkinson's, but they're definitely not experts. So it's important to keep this in mind as you meet with them. Once they are educated, they become your biggest allies on the inside. And I encourage you to take the time to help them empathize with your experiences, share the facts about the issues you care about, and help them help you by getting their boss to take a stance on the issue. So really quickly, before we move on to the national plan, I'm going to pause for questions before then, but I'm going to cover some quick tips and tricks that I tend to share with advocates as they're meeting with congressional staff and their members of Congress. So we're going to start before the meeting. So before the meeting, you prepare. You don't need to know every detail about the legislation, but it is helpful if you can tie your personal story to some aspect of the bill you're talking about. You don't want it to seem entirely disjointed, you talking about your personal story and then the legislation that you're trying to talk about. You need to know the name of the person you're meeting with and the request you're making before you go into the meeting, and it's entirely okay if you write that down. You are welcome to bring your notes to the meeting or event and reference them or read them directly as you speak. Sometimes advocates are worried when they are looking at a screen and reading, but really it can be helpful for staying on track. And I promise you, the staffers themselves are just honestly in all the fact that you wrote something down before coming into that meeting. During the meeting, be polite and remind them that you want to be their resource to their office, whether it's about Parkinson's disease or other issues that you might have some expertise on. Don't treat the meeting like a one-off. Remember, advocacy is in large part relationship building, not simply making a demand. It can take a while to get an office from a maybe to a yes, but I promise you it's worth the effort. And try as best you can to stay focused and on topic. Too often, meetings become diluted because someone wants to talk about a very personal issue or tangent. So, as best you can, keep the attention of the member or their staff on the meeting that you're focused on, the request that you're making. Also, the final thing I want to say is during the meeting, don't answer questions you do not know the answer to. Sometimes we make this mistake, but it's perfectly okay if you tell the person you're meeting with that you'll follow up with them with an answer to their question. And that leads me into follow up, the last part. Share a written version of your personal story or connection to Parkinson's disease with the congressional office. Sometimes offices actually keep a record of these stories so they can reference real life examples of how their issues are, or how their work on issues is impacting their constituency, how they are helping the people in their district or state. It may seem silly to write it down or share it with them via a meeting and then have to write it down and share it with them after the meeting. But I promise you that staffer is not going to be able to take notes as quickly as you're saying the words. So in the follow-up, also reiterate the requests you made during the meeting. Again, keep them focused on that and ask them when's the next appropriate time to check in on the status of your request. I keep this in mind whenever I'm meeting with congressional staff. For example, if I'm meeting with a staffer who's focused on a healthcare portfolio, but also appropriations. If there's a lot of appropriations happening on Capitol Hill, I let them know. If you want me to follow up 4 weeks from now, that works for me. You let me know what works best for your schedule. And then finally, say thank you. Throughout the process, it's important to be polite, understanding, and gracious with staffers and their bosses. Again, we want them to know that we're their allies on these issues and easy to work with. So I'm going to pause there to see if anyone has questions before we move on to talking about the National Plan to End Parkinson's Act specifically.
Any questions anyone has?
Also going to take this break for some water.
No problem. No, I think it's wonderful what you said of don't answer questions you don't know the answer to, or don't try to answer questions you don't know the answer to. And I feel like a lot of times when you're, you know, feel like you're on the spot, you feel like you have to have an answer to every question. And especially where research is concerned, I always get nervous in that regard because, you know, it's so high level, it's so science oriented. And when people ask me questions on that level, there are so many times I have to defer to, you know, I don't know the answer to that, but let me find out for you. And that's so much better than just trying to muddle your way through it and
Yeah,
give misinformation as well.
especially coming right out of college and going into lobbying, that was a mistake I made early on and learned really quickly from. You don't want to have to correct yourself after the meeting. And so it's always best to say, you know what, I'm going to get you that information from someone who knows better than myself. And they're going to appreciate that you have those connections and that wealth of resources where you can find the right answer and get it back to them rather than just, you know, fumbling through what you think might be correct.
Yeah, absolutely. And that's a good way to like work in your own experience as well. Like maybe you can use it as a bridge. Well, I don't know the answer to that, but I can tell you what I do know from my personal experience is this. All right. Any other questions or comments that have come up so far? If you'd like to ask a question, you can just take yourself off of mute, which is in the bottom left corner of your screen in most cases. Okay. We'll move on then, Mason, and then if people have more questions about this, even at the end of the conversation about the act, they can ask about that.
Yeah, happy to do that. And this next part is where I really expect some of the questions to come from, because everyone wants to know about what the National Plan to End Parkinson's Act is. And so now that I've talked a little bit about advocacy and how you advocate on behalf of public policy, we're going to talk about the national plan and its policy objective, where it is within Congress, and how we all, not just the Fox Foundation, but the Michigan Parkinson's Foundation and advocates from across the country, are working to help advance it. So the National Plan to End Parkinson's Act is first ever legislation solely devoted on having Congress focus on curing and preventing Parkinson's and ensuring quality care for those living with the disease. This legislation, its purpose is to create an advisory council comprised of members of the federal agencies and departments already working on Parkinson's, as well as people living with Parkinson's, their caregivers, healthcare providers, and representatives from nonprofit organizations that have experience in Parkinson's research and care. This advisory council will create a strategic plan to end Parkinson's and will be responsible for reporting to Congress every 2 years on its progress and its impact. So when I talk to congressional offices about this legislation, it seems like common sense. And advocates also seem like, why isn't this already happening? You know, they want to ask that question. And it's because there's not a congressional mandate. There's no one telling them to do this kind of work and coordinate it in a way that's really most efficient for the federal government. We know that in the federal government, there are often silos of focused issues, whether it's within the Department of Defense, or maybe it's the FDA, maybe it's the Department of Veterans Affairs, because we know a disproportionate number of veterans are infected by Parkinson's disease. But we know that these groups aren't working laterally and talking to each other about what the advancements have been in Parkinson's research, what needs to happen in terms of Parkinson's care. And so this advisory council really creates that nexus. It gets all the right people around the table to talk about how we're going to move the ball forward with Parkinson's disease. And I want to stress it's not just about research. This is also about improving the quality of care that's provided to people living with Parkinson's disease today. It's also about preventing folks from developing Parkinson's disease when and where we can. I want to note that Parkinson's is the fastest growing neurological disorder worldwide, and it's the second most common, only behind Alzheimer's disease. And obviously, we're discussing the National Plan to End Parkinson's Act right now, but I want to note that there already exists such a national plan for Alzheimer's, and it has been incredibly successful. It's resulted in much greater research interest and support for Alzheimer's disease since it was passed in 2011. And I want to stress that we are by no means trying to take from what Alzheimer's has done. We want to be just as successful because we believe both these diseases need to be impacted. So you can see sort of the overarching goals of this legislation. Again, this bill is modeled after the success that the Alzheimer's group has found. But we want to unite the federal government in a mission to prevent and cure Parkinson's. We want to alleviate the financial and health burdens on American families and ensure that those living with Parkinson's have access to care. And this is the type of language that's actually within the legislative text as well. These are the goals that the national plan seeks to accomplish. And so this is on this slide, you can see what I tend to describe as the 3 pillars of the national plan. One of the primary goals of this legislation is to create a greater research focus, federal focus on research towards a cure for Parkinson's disease. But this bill is also focused on improving quality of life for folks who are living with Parkinson's disease by making healthcare more accessible and relevant to people living with Parkinson's. And then finally, this bill will help identify mechanisms for preventing people from developing Parkinson's disease by limiting exposures to known environmental factors. Parkinson's disease today is assumed by researchers to be a combination of both genetic and environmental factors, like harmful pesticides or head injuries or military service related connections and more. And so the national plan actually focuses on each of these 3 pillars. It's about clinical research, but it's also about clinical care. And at the same time, it's about preventing folks from developing Parkinson's disease if and when we can. So now for the legislative update, and this is where I put my lobbyist hat on, and I give you the rundown and a quick peek under the hood of what's going on with the national plan right now. So the national plan this Congress has been introduced in both the House and the Senate. And so for those who are unaware, when bills are introduced into Congress, they can work synchronously. So as the bill moves through the House, it can also move through the Senate. I want to stress that this is not the first time that the national plan has been introduced. It's actually been reintroduced this year in March 29th of this year, but it was formally introduced in the 117th Congress. For those who don't know, Congresses work on 2-year cycles. And so the 2-year cycle from 2020 to 2022 was called the 117th Congress. And the national plan was introduced pretty late in that Congress. The House bill wasn't introduced until July of 2021, and the Senate bill was not introduced until September of last year. So essentially, there was 5 months for the Senate bill to pass through that chamber, and that was a quick timeline. But Congress had tons of competing priorities, especially appropriations package. For those who remember, we narrowly escaped a government shutdown, and we're hoping to do the same thing this September. Fingers crossed. But when that bill does not pass in a given Congress, it has to be reintroduced. And luckily, we have great congressional sponsors of this legislation. So in the House, you can see it's being led by Representatives Gus Bilirakis and Paul Tonko. And in the Senate, it's being led by Senators Shelley Moore Capito and Christopher Murphy. And what's really exciting is that last year, while the House bill was dropped in July and the Senate bill in September, this bill there actually dropped on the same date, showing even greater coordination amongst the congressional leads for advancing this bill. And as introduced, these bills are identical, so they're using the same language. We'll talk a little bit more about that in just a moment. But since the bill has been introduced in the end of March, it's gained a lot of support in Congress. The House bill has actually exceeded the number of co-sponsors that it was able to gain last year. We're at 91 co-sponsors as of today. I just checked before this meeting, out of the 435 possible. I want to stress really quickly that the number of co-sponsors is a great way to demonstrate broad bipartisan support on behalf of a bill, but there is no exact number that a bill needs to reach before it can pass out of congressional chamber or pass Congress. What happens is that when bills are introduced within Congress, they're referred to committees with jurisdiction over that piece of legislation. So for the national plan, the 2 committees that are most important are the House Committee on Energy and Commerce and the Senate Committee on Health, Education, Labor, and Pensions. Sometimes we call this House ENC, and then sometimes the Senate one is just called Senate Help as a shorter acronym. And even within these committees, they sometimes have what's called subcommittees, where an even smaller group of representatives or senators is focused on just those related to maybe health or transportation or other things that sort of help split up the jurisdiction of that given committee. And I want to talk about that for a moment because we've had some legislative action in the House. Just the month before last, in June, the House bill actually has passed out of the House Energy and Commerce Health Subcommittee. So this means that the bill now heads to the full committee for consideration. And after it passes out of the full committee, it goes before the entire chamber. So the full House of Representatives are being considered. As it works through this process, these bills can be amended, sort of changed or edited as they work through this process, as they're being debated in these committees to ensure that they get the votes from members of Congress on both sides of the aisle. Luckily, the national plan is bipartisan. We're working with both Republicans and Democrats to ensure that this bill gets passed. And I'm going to pause really quickly to talk about sort of the political nature of Congress right now. In the House of Representatives, the political margins are less close than they are in the United States Senate. So at this moment, the way we are building co-sponsorships in the House is not defined by the political party. So we're looking at both Republicans and Democrats and adding whoever is interested in being supporters of this legislation. However, in the Senate, we're taking a slightly different approach. The Senate is adding co-sponsors in a one-for-one basis. And what that means is for every Republican that we get on the bill, we get 1 Democrat on the bill and vice versa. I want to stress this really quickly because in the Senate right now, we're really interested in getting Republican co-sponsors. We actually have 3 or 4 different Senate Democrats who are interested in getting on this legislation, but they're unable to at this moment because we need to get more Republicans to match them. So that means right now, as a lobbyist, for every Republican I'm able to help get on the bill, I'm actually able to get 2 co-sponsors in the Senate because we're able to add those senators as those Republicans get on the legislation. So that covers the House, but in the Senate, I want to focus on the committee consideration process. I'm going to give you another peek underneath the hood really quickly and let you know that there are some rules that have been instituted this Congress for bills that are going through the Help Committee. For example, each bill has to be ensured that it's received TA or technical assistance from the department or agency that would be implementing that legislation. Luckily, we have worked with HHS, the U.S. Department of Health and Human Services, to ensure that this bill has that TA and it's being incorporated. And then second, the bill has to receive a CBO, or Congressional Budget Office score, before the committee will consider legislation. Again, luckily, this bill is actually no cost legislation, and we believe that CBO would not score this bill. So they're going through that process right now, and that's the first step before we start getting into committee consideration for that legislation. And in the Senate, you can see we currently have 12 co-sponsors, but again, that doesn't speak to the true nature of co-sponsors, because we're waiting to add some Republicans so we can get more of those Democrats who are waiting in the wings to be added to that legislation. I also want to pause really quickly to talk about advocate engagement throughout this process. I know I mentioned it briefly earlier, but we actually had a House Energy and Commerce Health Subcommittee hearing where they debate and talk about the legislation before actually having a vote on it. When they have a vote on the legislation, that tends to be called a markup of the bill, or a vote. And we actually had a hearing before the markup. And during that hearing, we had a patient advocate from the state of West Virginia testify before the House Energy and Commerce Health Subcommittee. This, again, was done within a week's notice. And so we had George Manahan, who is this awesome standout advocate from West Virginia, speak before members of Congress on this committee as they asked him questions about the bill, what's the latest and greatest in Parkinson's research and care, and what this bill will do and how it's going to make an impact in the lives of himself and other advocates from across the country. And George simply knocked it out of the park. Could not give him higher commendations for how he was able to voice his support for the bill, but also just representing our community during that subcommittee hearing. And if you're ever interested in getting some of the clips of that hearing, I'm happy to share that with you. I about cried, and I was just sitting behind him having to hold it together. But we're looking for similar actions in the Senate soon. So be on the lookout. And if there's opportunities, we're happy to share it with folks to ensure that the patient community is being represented appropriately as Congress is considering this legislation. I'm going to pause really quickly to talk about the legislative process. You can see from this diagram that there's a synchronous process that happens in the House and Senate. So when bills are introduced into the House, they can also be introduced into the Senate. But if they're not, after they pass out of that chamber, they have to go to the next chamber for consideration. So you can sort of see that there's a flow here where the bill has to be considered by both chambers before the differences between the bills are resolved to what's called a conference, and then it goes to the president to be signed or vetoed. In the House right now, we are at the moment of committee action or inaction. We've actually already had subcommittee consideration of the legislation, and we are working with our lead offices, who both happen to be on the House Committee on Energy and Commerce, to ensure that the bill is considered by the committee and eventually passes to the full chamber. At that point, it'll actually be considered passed out of the House of Representatives. And we're really going to be focused on the Senate strategy as well. So in the Senate, the bill has been introduced, and we're currently building bipartisan support by adding co-sponsors to the legislation to ensure that it gets on the docket. It gets the attention of the committee with jurisdiction over that bill, again, the Senate Health Committee. And we're expecting that in the next couple of months, and have been working diligently with committee staff to ensure that happens. Once the bills go through this process, again, there can be edits or amendments made to the legislation. So there might be slight differences in the legislative text that passes out of the House or passes out of the Senate, although the bills were introduced with the exact same language. They're called identical bills. And then it goes to a conference to resolve those differences if necessary for a vote. After that, it's actually signed into the law by the president, and then the regulatory activity, which is really the exciting part. All this stuff with Congress is great, but we're really looking forward to making progress through the national plan. And the regulatory activity, the actual implementation of the national plan, is when that happens. And that only happens after it's been signed into law. So I want to say that what we're doing right now is really important, but to get to the point where we're actually having an impact through this legislation, we have to get it signed into law such that it can be implemented through HHS and the other groups who are going to be working on this advisory council. I also have this link here. This is for the legislative process as defined by the Library of Congress. It's a great resource. They try to put it in layman's terms, so anyone who is interested in learning about what can be a convoluted and confusing process and all the rules and procedures, they help spell it out pretty easily. So I'm going to pause there before I talk a little bit more about the National Plan to End Parkinson's Act and how we're helping advance it and ways that you can be involved. And see if you have any questions about anything I said related to the national plan, its goals, the purpose of the bill, what it's modeled after, where it is in the legislative process. Let me know if I can help answer any questions there or clear anything up.
Questions? Just feel free to take
I,
yourself off of mute. Yeah,
I have a question. Can you hear me?
Yes,
yes,
sir.
Nate, we can hear you.
Great. Hey, Mason, this is excellent. You're presenting this data very effectively. When you said veterans are affected disproportionately, I perked up, being a veteran. Are veterans drafted in the same bill, or are they treated separately through Veterans Affairs, or how are we, the veterans, being represented in the bills?
Yes, sir. And I can help clarify some of that information. So in the United States, it's believed that there's approximately 1 million people living with Parkinson's disease. And the Department of Veterans Affairs actually estimates that about 110,000 of those folks are US veterans, about 11%, a disproportionate number of US veterans. Veterans are represented within this legislation. Specifically, we're going to have representation on the Parkinson's Disease Advisory Council, not only from the DoD, but also the Department of Veterans Affairs, because we believe those folks are important to have at the table to talk about what is happening in Parkinson's research. There's actually a research program within the DoD related to Parkinson's, as well as how are we providing the care for people living with Parkinson's disease, maybe those that qualify for disability compensation through the Department of Veterans Affairs. So we want to incorporate Departments of Veterans Affairs and the DoD within this legislation because we know that there's such a unique impact on veterans. Oftentimes they're exposed to environmental factors through their military service. And we want to make sure that they're represented in this national plan, understanding that they have a disproportionate burden of the disease on their shoulders. I hope that helps.
Excellent. It helped a lot. Thank you. I'll have more questions. Sorry.
Awesome. Any other questions? Okay, you're welcome to hold on to the end. I'm going to briefly talk about how the Michael J. Fox Foundation is engaging on behalf of the national plan. Just know that there's more than even just this on this slide, but I also want to talk about how you can be involved and be engaged in this process as well. So the National Plan to End Parkinson's Act is being advanced by the Michael J. Fox Foundation, specifically through direct lobbying, which includes grassroots and grass tops engagement, coalitions, and public relations. So direct lobbying is when myself and other folks who are hired by the foundation meet with members of Congress and their staff to discuss this legislation and why it's important. But in nearly every congressional meeting that I have, we have advocates join. We believe it's important to lead with the patient voice and to have people share their experiences with Parkinson's disease so members of Congress and their staff understand why it's important to support this bill. I want to stress that this legislation is not Michael J. Fox Foundation legislation. While we help incept the idea and are working diligently and primarily with congressional offices, this is a bill on behalf of the Parkinson's community. It doesn't just serve the needs of the Michael J. Fox Foundation. While we are focused on Parkinson's research, we also care about how our community is accessing the healthcare that they need, and also the ways that we're preventing Parkinson's if and when we can. And when I talk about grassroots, that's literally any person across the country who is interested in engaging on behalf of this legislation. Any person who takes action through our action center or calls their members of Congress or attends a public town hall or meeting, that's a grassroots advocate. Grass top advocates tend to be members or tend to be constituents who have a personal relationship with their member of Congress. Sometimes they went to the same middle school together and they happen to have their phone number, or they go to the same church and they can speak with that person directly. And those grass tops connections are also really helpful because you have, again, a really personal form of connection with that member of Congress. And you can explain to them how it's not just impacting their constituency, but someone in their lives. And so we're working on both grassroots and grass tops activities to ensure that we're getting members of Congress on this bill. And that can look like things from, direct phone calls from someone who we know who has a relationship with, say, Senator Peters' office, or it can also look like 100 people from a single support group reaching out to their district representative and getting them on the legislation by sharing their personal stories and writing through an online action form or through a letter campaign. We believe both forms of advocacy are important, and we're engaging both of these folks in our direct lobbying efforts as well. I also want to mention coalitions. It's hard not to, considering part of the reason we're having this conversation is because the Michael J. Fox Foundation and the Michigan Parkinson's Foundation are working in coalition through what's called the Unified Parkinson's Advocacy Council. This is not the only coalition that's engaging on behalf of the national plan. For example, the Movement Disorder Policy Coalition within Washington, D.C. So this includes Parkinson's as well as other movement disorders, has also been supportive of the national plan, has been willing to lend their name in support of the legislation. So we're working with coalitions as well as public relations. We're trying to get news media on behalf of the national plan to show that this is an important public issue that should raise the priority of members of Congress, but also to educate advocates like yourselves and others. There's many people in our community who don't know that this legislative effort's being led, and a public relations effort helps them raise their concerns or their level of awareness around the legislation and try to seek ways to get involved. So I want to say that each of these is just part of the pillars that are advancing the national plan, but I'm sure there's tons of activity that are going on that we're not even aware of. And so this is just primarily how we think about how the Michael J. Fox Foundation is engaging, but I want to talk quickly about how we are specifically seeking to engage grassroots advocates in the national plan's efforts. So we've created what's called the National Plan Action Center. It's an online action center or ways for advocates to get involved on behalf of advocating for the national plan. On this resource, we include ways to call your members of Congress, which include a call script and ways to call them directly, as well as a number to the Capitol Hill switchboard, so you can ask to be switched over to the office of your member of Congress. We also include a campaign that allows you to write an email to your member of Congress. And this form is entirely editable, and we encourage advocates to include parts of their personal story when they're sending these letters to their members of Congress, even if it's only a paragraph or two, because those are the ones that are most likely going to be read and actually be received by congressional staff and their boss. And then also we're including ways to share this information with your friends and family. It's one thing for you to take action, and it's another thing for the 5 people who are supporting you to support this legislation as well. And so we're trying to involve not just people living with Parkinson's disease and their loved ones, but literally their whole networks on behalf of the National Plan to End Parkinson's Act. These are fairly easy and simple ways to engage on behalf of the legislation. For example, when you call your member of Congress office, it's very rare that those phone calls last more than 3 minutes. They want to know what the issue is, why you support it, why their member of Congress support it, and what impact it's going to have. And that's honestly fairly quick to talk about. But if you participate in any of these online action forums, you also have the opportunity to be invited to a meeting with your member of Congress and congressional staff. So for folks who call their members of Congress through our online action center or write their members of Congress, what we do is we reach out to them as we schedule meetings with their congressional offices and their staff, such that they can be invited to these meetings to share their personal stories through a Microsoft Teams meeting or a Zoom meeting, because what we've learned is post the COVID-19 pandemic, this is how offices are really interested in hearing from constituencies. Oftentimes before the COVID-19 pandemic, they were focused via Hill Days, huge moments where everyone rushed on the Capitol Hill for 2 to 3 days and met with ever so many members of Congress in person and shared the priorities directly that way. But the COVID-19 pandemic has honestly opened a lot of opportunities, and you can meet with the congressional offices via a Microsoft Teams meeting or a Zoom meeting and have the exact same sort of experience where that member of Congress or their staff is listening to the issues that are important to their constituents without having to buy a flight to and from DC. So what I want to encourage you to do is participate again in any of the forms of advocacy that you feel most comfortable with. But whenever you are invited or receive an invite to participate in a congressional meeting with the office or the staff member, I really hope you consider joining, because you'll be meeting with someone like myself, someone who is going to help talk about the legislation and make it easy for you to just share how Parkinson's has impacted your life. Again, you don't have to know every detail of the legislation. That's on me, and that's my job, and that's what I share with constituents when they meet with me. We try to make it as easy as possible. Especially if you're meeting with myself, I tend to meet with advocates a couple minutes before the meeting just to make sure their audio and video is working. I tell them how the meeting is going to be run. We're going to start with introductions. We're going to have the staffer talk about themselves and their familiarity with Parkinson's disease, and then we're going to fill in the gaps. I'll talk about Parkinson's broadly and the national plan, what its purposes, but I really would like you to focus on how you can share your personal story. What are the 3 to 5 minutes of what you would like to say in this meeting to help that staffer empathize with what you've gone through? And at that point, we open it for questions from the staffer. And then after the meeting is ended, I tell the constituents on the call, the advocates, about how we're going to conduct the follow-up. And we try to make it a really simple and easy process such that you can engage in every step of the process, but also feel like there's not an entire burden on your shoulders for sharing your personal story. So that's all to say. There's tons of resources on this National Plan Action Center. We try to make it as easy as possible for folks to participate in advocacy. And as part of that, we also share information on behalf of the legislation itself. And I'm going to cover one of those resources really quickly. So this is the National Plan to End Parkinson's Act one-pager. We share this with congressional staff for meetings that we have or schedule with them because it explains everything that a staffer really needs to know about the bill and Parkinson's really succinctly. I want to explain that this document, the intended audience is congressional staff, but we do host it on our advocate website in case advocates are interested in reading it and or using it. But I like in these presentations to cover it with you all because I want you to understand why it's written for congressional staff, and maybe it doesn't include everything about Parkinson's disease or all the details of the legislation, but I can help explain what congressional staff are going to find most important and interesting. So from the top, we start with what our request is. It's to co-sponsor the National Plan to End Parkinson's Act. And we also talk about the important parts of the legislation. For example, the fact that it is bipartisan, which is really important, especially in this Congress, where there are a lot of partisan issues. This bill is no cost legislation. There's no funding attached with setting up an advisory council. And we want to stress that when we're talking with congressional offices, especially understanding that there are a lot of physically conservative offices, especially in the House of Representatives, that are not interested in spending money on new programs. So this is bipartisan, no cost legislation that will, for the first time, unite the federal government in a mission to prevent and cure Parkinson's disease, as well as the other goals in the legislation, like alleviating the financial and health burdens and reducing government spending over time. Essentially, we make the request and we give them a brief synopsis of what the overarching goals of the legislation are. Then we talk about the policy objective. We make it clear and simple that it's about setting up an advisory council that comprises members of the federal agencies and departments with hands in Parkinson's research and care, but also about non-federal partners. And we stress this within our meetings because we believe it's important to have people living with Parkinson's disease, their caregivers, their care partners, their researchers, and other non-federal experts at that table. This is not insular to the federal government. We all want to be working together on the plan to end Parkinson's. And then also in here, we talk a little bit more about those 3 pillars that I mentioned before. So for example, improving health outcomes, reducing the financial impact, and limiting exposures to environmental triggers. We also give them some of the fast facts about Parkinson's disease, so some of the things that we believe are really important. You can actually see that statistic that I cited earlier about we believe that there's more than 1 million people in the United States with Parkinson's, and a disproportionate number of those people are US military veterans. We also talk about the financial impact of Parkinson's disease, not just to the federal government, but also on the impact on patients and their families, and how that cost is going to increase over time. This also helps create a sense of urgency when staffers are reading through our one-pager. And then finally, we reiterate our request and we share with them all the information they need to know to get their boss on the legislation, which includes the lead offices and staff contacts. So these are the folks that your members of Congress and their staff need to contact in order to get on the legislation, as well as contact information for someone at the foundation in case they have more questions, in case they would like to reach out to us and ask questions about the legislation. So I just wanted to walk you through this document. It seems like it's a bit much, or maybe it's a little confusing at first, but this is everything that a staffer needs to know about the bill, what its purpose is, and how they can get their boss in support of it. I also want to flag that we include a frequently asked questions document that I think is really helpful for advocates, and we try to update it as we receive more questions that have come up often. For example, we have the question around, does this bill include a plan for Parkinsonism conditions like Lewy body dementia, multiple system atrophy, progressive supranuclear palsy, and cortical basal degeneration? And our answer is yes, it sure does. This legislation actually defines Parkinson's as Parkinson's disease and other neurodegenerative Parkinsonisms, including but not limited to each of those Parkinsonisms that I just mentioned, as well as Parkinson's related dementia. So I want to stress this because we've sometimes had presentations with other groups, and this is something that they've asked a question about. And I want to make sure that it's represented in these frequently asked questions documents. And so if there are questions that come from you all, we may also consider adding those to this online resource. So it's a living website. It can be updated. And so definitely be on the lookout. And if you have a question, please do reach out to myself or just the policy team in general, and we'll try to make sure we get you those answers. And then finally, I would list a lot of the ways that you can get involved right away. I already covered some of these, but you can sign the petition in support of the national plan. This is you stamping your name in support of the bill and telling your members of Congress that you'd like to see action on their behalf to get it passed. You can call your members of Congress. We try to make it as easy as possible. In a moment, I'm going to share with you what the draft script looks like. And I want to stress again that you can infuse your personal story into anything that you say with your members of Congress and their staff. Like when you write them, you can send an email to the congressional staff and include a brief snippet of your personal story because it's entirely editable, our online form. Or you can just copy and paste it into a Word document and then edit as you see fit and send a letter to your congressional office. And then also, again, stressing that you can share with your friends and family all of this information too. So this is the draft script that I wanted to talk to you about. And then you can see why it might last 3 to 5 minutes at most while you're having a phone call with the congressional office. You start out by telling them your name and where you're calling from. This helps the staffer know that you are a constituent of their boss. Then you ask them to support the National Plan to End Parkinson's Act, and we include the bill number right there for you to reference, which is also really helpful to the staffer. They may not be able to write down the entire name of the bill before you're done saying it, but they can sure write down that phone or write down the number of legislation. And then the next part is about explaining what the national plan seeks to accomplish. And again, it's really the important parts of the legislation that staffers are most interested in. Finally, we end the phone call by reiterating our request for their support of the Parkinson's community by co-sponsoring the bill and letting them know that we're happy to be their resource and answer questions, whether they have it about Parkinson's disease or the national plan, and then ask them to give us a response whenever they decide whether they would like to co-sponsor the bill or not. And then finally end with a thank you. What we want to do is, again, share with them all this information in a way that's polite and brings them into a conversation rather than simply making a demand of their office. So I want to end my presentation on ways that you can take action today. Many of these are what you just saw on a couple slides previously, but you can sign the petition, you can write or email your members of Congress, you can call them. You can also invite your members of Congress to join your support group meetings or boxing classes or community event. I actually want to highlight that last week I was in Houston with the Houston Area Parkinson Society, another member of UPAC, and they actually had an in-person boxing demonstration with their member of Congress. They invited Representative Lizzie Fletcher, and I was able to travel down to Houston, give a brief spiel on the importance about policy advocacy in the national plan. But really, it was about Representative Fletcher connecting with members of the community and understanding, how they're fighting back against Parkinson's disease. And then finally, you can also find the events that the members of Congress themselves are hosting, whether it's a local town hall, a public forum, and you can share information or ask questions about the national plan to end Parkinson's Act at those as well. So that's the end of my presentation, but I'm going to pause for questions and I can stay on just a little bit longer if it's helpful. But let me know what questions you have.
Yeah, I think we're going to have a few questions actually, Mason, and we've got one in the chat right now from Sharon, and it sounds like she's been meeting with her state rep even today. But she said, how much time does it take to have acts move through Congress?
That's actually a good question, and something I want to stress that we think is really successful on the national plan. It can take several Congresses. Remember, Congresses are 2-year cycles for bills to be considered and then passed by the House and the Senate. Sometimes bills are introduced up to 5 or 6 Congresses, or maybe the bill actually doesn't ever pass through Congress. But what we've seen is a lot of bipartisan support in a really short time. Again, it was just at the end of March that the bill was introduced into Congress, and we've nearly got 1 in 4 members of the House of Representatives already co-sponsoring this legislation. We've already seen action within the committee that's going to have jurisdiction over this bill. So that being said, what we have right now is still a bit of runway of time. We have about a year and a half before this congressional legislative session ends. But that being said, we still want to make sure that it gets passed and passed quickly, because we believe this bill is something that's not going to be hard for members of Congress to really debate or consider for a long time. It's bipartisan, no cost, common sense legislation. But in reality, it can take a long time for bills to move through Congress. But we understand that people living with Parkinson's disease want to see action now.
Do you have like a goal, like internally, like we want to have it passed by this period of time?
Yes, I don't want to put my foot in my mouth, but we are actually talking with our congressional leads before the end of this year, because we would like to have it passed before they start debating and have everything come back in the start of next year, which is really ideal in the situation. Again, we're starting to work up against some more of the political issues that are happening in the House of Representatives, specifically around appropriations. So we're being mindful of those and understanding that may delay the timeline. But in reality, having already some committee action around the legislation is really exciting. So if I had to guess, I would love to say by the end of this year, we would have the legislation passed. But if it's not passed by the end of this year, we have an entire year next year to ensure that the bill moves forward.
Okay, that's wonderful. All right, like I said, I have a couple questions, but I want everybody else to get their questions in there. So please feel free.
I have a question. Is this process that you're going through right now, has it been compared to any other processes like for AFib or any other disease? So you know it's going to work in the long run.
Yes, so this legislation is modeled after the success that the National Alzheimer's Project Act has found. That bill was passed in 2011. And before I start talking about how much research is funded for either disease, I want to again stress that we are not competing for funding with the Alzheimer's Association. What we want to see is model that same success that the National Alzheimer's Association has found. So when I do this comparison, and please keep that in mind, but back in 2011, the Alzheimer's project, Alzheimer's funding at the National Institutes of Health and the Parkinson's disease funding at the National Institutes of Health were both in the couple hundreds of millions of dollars, right? That is not the case today. While Parkinson's disease still is funded in a couple hundreds of millions of dollars, actually less still today than Alzheimer's was funded in 2011. Alzheimer's disease is funded in the several billions of dollars, billions with a B, as in like 3.7 in terms of research funding at the NIH. And it's because they have a focused group. They have an advisory council themselves that is saying this is where we can maximize investments and research towards ending Alzheimer's disease. But they have a congressional mandate to do that type of work. And that's the kind of work that we want to see done on behalf of Parkinson's disease. So again, it's not that we're competing with Alzheimer's, but we want to see the same sort of success that they've been able to find through having a focused, coordinated effort at the federal level on behalf of a specific disease.
Right, okay, thank you.
Yeah.
And I will say too, I worked for Alzheimer's Association before coming here to Michigan Parkinson Foundation, and it was a steady climb uphill. And I think you're absolutely right. It's not competition. It's not, we're competing against each other, but how do we model after the success that they've had? And that's why I think UPAC is so important and the grassroots efforts are so important, because I saw how people were mobilized on the local and national level there. And I think we can do the same here.
I absolutely agree, and that's why I'm investing a lot of my time at the foundation in UPAC. The Fox Foundation itself is not a chapter-based organization. We don't have a dedicated lead in every single state that has branches out to different support groups and networks like a lot of these other organizations do. And so that's why we see it being integral to work with what already exists as the infrastructure in these states and districts to ensure that we're getting advocates involved. And we try to make it easy for UPAC members to engage through opportunities like this and others to share information with their folks, to get them involved in policy advocacy, because we all want to march to the same drumbeat, because this bill, again, is not just serving the needs of the Michael J. Fox Foundation. It's really on behalf of the broader Parkinson's community. And we believe any Parkinson's nonprofit organization that wants to help us do that is welcome to join us in advancing the legislation.
Wonderful. Other questions? Okay, well, someone
I'm
made me.
sorry.
Oh yeah, go ahead, Nate.
Trying to find the cursor to get it on that unmute, and I'm like, I've got two screens going here. So I think Mason kind of hit on it earlier, and I don't want to sound like a cynical American citizen, but we are seeing a lot of politics in Washington, D.C. How much is that a factor in moving along an important bill like this when, what we see in the news media and et cetera seems to be so dysfunctional? Are we staying above the fray, or how can we?
That is a very good question. And the answer I'll give you is that this bill itself, while it's bipartisan and should have the support of every member of Congress, it's very straightforward, common sense, it's even no cost. That doesn't mean that it's still entirely above the fray with political issues. So what I will say is that we are working diligently with our leads in the House of Representatives, Representative Billirakis and Tonko, and then in the Senate, Senators Capito and Murphy, to make sure that if at all possible, we can stay above those political issues and that they by no means impact this legislation and whether it's successful or not. What we saw, especially at the end of last year, last Congress, if you will, was that there's tons of politics flying left and right around the appropriations process specifically. And while this bill is not tied to appropriations, that took up so much oxygen in the room that other pieces of legislation just weren't even being considered because members were stalemating each other on behalf of political priorities, so they couldn't have a win of X, Y, or Z. And so what we're doing is working diligently with our offices, maneuvering the bill, if you will, through the political process such that it doesn't become a partisan battle. But we have been refocusing our efforts on that specifically, just because as things heat up in one side of Congress, it sets fire to the rest of it. And so what we're seeing right now, especially in the appropriation space around policy writers that are tied to highly important political issues, whether it's about abortion or other issues, what we're trying to do is stay focused on how this bill is bipartisan, how this bill can bring together members from across the aisle. But that's not to say that any bill goes unscathed from that process, because at the end of the day, members of Congress are people, and they are going to act like people, not just working in silos. So we're trying to work diligently with our congressional leads on that. But I think that's a really insightful question, and we may learn more about that as the year goes on. But as of right now, I think we are sitting fairly clear from some of the bigger political bullets that have been flying through the air.
Thank you.
Mason, I have a question about, because I got your wonderful email today on just the public policy highlights from the month of July, and I'm going to be sending this along to everyone as well. We try to send this out to our whole email base when we get these updates. But I saw the 5 research registry wins in here that Maryland, Missouri, Nevada, Ohio, and Nebraska. Nebraska, it just got their research registries. Can you talk a little bit more about what those research registries are and how states can fight to get them?
Yes, I can. And this is actually, it relates back to that practicum that I was telling you about at the Medical University of South Carolina. So these Parkinson's disease state registries are working to better inform our understandings of the prevalence. So how many people have Parkinson's disease in a given state, and the incidence, how many people are being diagnosed, how many new cases of Parkinson's are there in these states. And what we've been trying to do is working in state legislatures that we believe these bills can pass, because we want to find the low-level fruit such that we can have these wins in the policy space, and then it results in greater research and understanding about diseases in this space. So as of right now, we are still waiting to hear back from the CDC on their estimates of Parkinson's prevalence and estimates across the United States. They would be the leading government agency responsible for finding that information. And there's actually a program called the National Neurological Condition Surveillance System We don't love the name. It sounds a little big brother, but the purpose of that NNCSS is to have a more accurate head count of the people living with not just Parkinson's disease, but also multiple sclerosis, and then eventually build out to other neurological diseases. But right now, what we're seeing is CDC has stalemated. We haven't actually received that information from them just yet. But what we're working to do is have these state governments also create similar systems that will eventually feed into this larger national system. So we can have a better understanding of who has Parkinson's in the United States, which states are seeing some of the greatest increases in Parkinson's cases. That way we can better understand what might be causing that. What are maybe the environmental factors in a given state, or maybe we can learn a little bit more about how geography impacts demography, or how people exist in a given state. So part of what I've been doing with the Medical University of South Carolina is helping them set up a disease registry in the state of South Carolina. A lot of the Parkinson's patients in South Carolina are believed to be patients of MUSC, and so that's part of the reason why it's housed there. But they also have access to a lot of the clinical providers in the state who are diagnosing people with Parkinson's disease. And so what they're trying to do is build out this system to better understand Parkinson's disease in South Carolina, but we're also looking at different geographies from across the country. So from Nebraska to Missouri and these other states to better understand Parkinson's, as we're waiting for CDC to give us more information about what they believe are the best estimates for Parkinson's. You would believe that we could just pull this data from somewhere, but that is not how healthcare data works, unfortunately. So what we've been doing is working with state departments of health, provider associations in these different states, setting up actually very similar advisory or committees or councils to see about how we can get that data and then use it to better understand the research around Parkinson's disease, as well as how these patients are accessing care. For example, if there's a high concentration people living in Nebraska with Parkinson's, but there's only 2 care providers, that may serve as rationale for providing grants to the state of Nebraska to hire more movement disorder specialists and then inform further policy decisions. So the ultimate goals of these registries are really around Parkinson's prevalence and incidence as of right now, but eventually over time, we're hoping to grow them to something that's even more complex and useful on behalf of not just researchers, but also patients living with Parkinson's in those states.
Well, we are in. Whenever Michigan it comes up on the docket as a state to be looked at, we're in. Is that also where the stat on veterans? Because we've been looking, Nate Jolliffe and I on this call have been looking for this stat for some time now, the 110,000 vets out of the million people with Parkinson's. Is that also from the CDC or some of this collective information?
That data is actually specifically from the Department of Veterans Affairs.
Okay. Okay.
Yeah, so I believe it's listed on their website. Departments of Veterans Affairs actually have what's called the PODREC, so the Parkinson's Disease Research, Education, and Clinical Centers. And these are centers within the Department of Veterans Affairs, sort of network of healthcare providers that provide high quality care to people living with Parkinson's disease. Unfortunately, they're primarily located around the coast, and very few, actually I don't believe any exist in middle America. And so there's disproportionate or disparate access to these sort of clinical research centers. But the real issue is that they're underfunded by Congress. And so we actually have a person on the Michael J. Fox Foundation's team that's been working on increasing that budget line item within the appropriations process, which again is mired with a lot of other political battles going on. But we're trying to see increases in that research funding, specifically within the Department of Veterans Affairs, because what they do is provide high quality services to veterans in sort of like a one-stop shop sort of format, so that you're able to see sort of any healthcare provider that would be beneficial to you as a person living with Parkinson's disease whenever you research or whenever you reach these research or clinical centers. And over time, ideally they are conducting research, but as of right now, with the limited staff and funding that they haven't actually been able to do much research just yet. But that may be also a topic that's handled through the national plan, to talk about how there are these opportunities that can be influenced through public policy at the federal level to refocus and make sure that we are reinvigorating that sort of program within the Department of Veterans Affairs.
Let's see. I have one other question, but I want to leave room for others to ask. Any other questions? Okay, I'm just gonna ask my last question here, and I know it's kind of a big one, so feel free to just, get us more information that I can send everybody as well. But we had a talk, a week ago today about just some of the things that I and another staff member and a couple other folks had learned at the World Parkinson's Congress. And a big part of that conversation was environmental contributions of Parkinson's disease. And I just was wondering if you could talk a little bit about what MJFF is doing, what sort of action they're taking with the EPA for some of these environmental contributions.
Yeah, happy to. With the EPA specifically, our focus right now has been around an environmental contributor to Parkinson's disease called paraquat. We are actually part of an ongoing lawsuit or litigation around the re-registration of paraquat in the United States. So for those who don't know, this is a chemical that is often sprayed on crops in order to kill bugs as a pesticide. But what we know is that exposures to paraquat greatly increases your risk of developing Parkinson's disease. And so we believe that there is an undue risk or danger posed to the folks who are when handling these crops, but also the communities around the folks where this chemical is being used. I want to quickly note that an interesting fact is that it's actually banned in so many other countries across the world, even in the country where it's produced. And there's actually been recent federal legislation introduced to ban paraquat and other harmful neurotoxins through federal legislation. And we expect the House bill of what's called PACTCA, and actually had the bill pulled up. It's the Protect Americans' Children from Toxic Pesticides Act. It's being led by Senator Booker in the Senate right now. But we expect the House bill to be introduced in the coming weeks, if not the coming months. So there's legislation as well as litigation that's ongoing around these sort of re-registration of what we know are harmful triggers or factors or contributors of Parkinson's disease. There's also some recent research around trichloroethylene and exposure to veterans at Camp Lejeune. As a North Carolinian who actually didn't grow up that far from Camp Lejeune, this is an issue that's important to me. But we know that veterans who served at Camp Lejeune, through this new research article, it was discovered that veterans who had served at Camp Lejeune versus other veteran bases actually had a much higher risk of developing Parkinson's disease later in life too. And so these sorts of research updates the ways in which we are studying exposure to these environmental triggers, then influences congressional action on behalf of allowing these people to apply for example, veterans disability benefits from that exposure that they received while they were serving in the military on that base. And so what we're hoping to do is have the Department of Veterans Affairs and other relevant agencies actually do this research to better understand where there have been these exposures so people are appropriately compensated for the fact that they were exposed to these dangerous chemicals through their service. But also at large, looking at how we can focus on better ways to grow crops in the United States without unnecessarily exposing to what again are known neurotoxins, things that are going to have more people develop Parkinson's disease over time. So my answer in short is legislation and litigation, where we're trying to have it going on all fronts because we believe it's important that if we can prevent Parkinson's disease, then we can have those folks not have to worry about the health burdens and the emotional or the economic costs that are associated with Parkinson's disease later in life.
Well, thank you so much, Mason. This has been a really enlightening discussion. I can think of so many things that we want to take action on just as a group right now. And I can tell everyone on the call, you will get the slides. You're going to get the information I was referring to, the kind of July highlights from the Michael J. Fox Foundation for Research as well. I also want to say that this recording is going to be up on our YouTube channel that can be found on our website. As well as all of our educational programs that we do virtually. So you can check that out on our YouTube channel. And then I want to give a quick plug for our Traverse City Parkinson's Walk that's going to be at the Civic Center in Traverse City, not this Saturday, but next August 12th. So please join us if you're in the area. But really, I know on behalf of everyone on this call, I'm getting texts right now just to how much people are really enjoying this. We just want to say thank you, Mason. You are welcome back anytime. And if you need anything from Michigan, please do not hesitate to reach out to us. We are on board and ready to go.
Thank you all. Again, it takes a special person to take time out of your day to then share your story around policy advocacy. So just thank you, especially from a lobbyist, but also as a person who's also been personally impacted by Parkinson's disease. Thank you. It reminds me often of my friend Steve whenever I get to meet with advocates and hear their stories. So I hope you have a great night and appreciate y'all hearing me out.
Thank you so much, Mason. Thanks, everybody. Have a great night.